Brace yourselves. California may soon be facing a health insurance price hike that could hit you right in the wallet. And the reasons behind it? They're not only complicated, but could also set off fierce debate about who should shoulder the cost of healthcare. Let's break it all down and make sense of what's at stake, step by step. According to the latest announcement from Covered California, the state's official health insurance marketplace, people buying their own coverage in 2026 should expect a noticeable premium increase, averaging 10.3%. For many, that's already a tough pill to swallow, especially as it follows an already substantial 7.9% jump for 2025. The key culprit? Growing expenses for hospital visits, doctor care, and prescription medications, costs that seemingly never stop climbing. But here's where it gets controversial. This could be just the beginning. If Congress doesn't take decisive action, a safety net that's kept coverage affordable for millions, the enhanced premium tax credits introduced in 2021 might vanish at the end of next year. Without these federal subsidies, monthly premiums for the typical Covered California policyholder could skyrocket by a staggering 66%. That's not a typo. 1 in every 20 Californians, about 1.7 million people, could be asked to pay 2/3 more each month, solely because of the loss of this federal support. Jessica Altman, the executive director of Covered California, put it bluntly. The last thing Americans need right now are soaring health insurance costs. She's urging Congress to step in, but time is running short. Imagine the pressure of possibly losing your coverage, or being forced to hunt for a new plan you can afford. For anyone new to the system, Covered California works a bit like an online shopping mall for health insurance. It allows people to compare different plans and prices from various insurance companies, and in many cases, it offers financial help to reduce monthly payments. Here's a bright spot. California isn't just sitting on its hands. To cushion the blow, the state government will chip in an extra $190 million in subsidies for the lowest income residents, starting in 2026. But here's the part most people miss. Even with that help, it barely makes a dent in a gaping $2.1 billion shortfall left by the potential end of federal support. Despite these challenges, Covered California's marketplace remains relatively robust. 11 different insurance companies are still offering plans statewide. So most people have real choices. Though, in a twist for 2026, Aetna is pulling out of the marketplace, leaving 21,000 customers needing to select new coverage. Is that a sign of instability, or just healthy competition? That's up for debate. Here's an angle that may surprise you. While a 10.3% average rate hike sounds steep, it's actually about half of what's projected for the rest of the country, where the typical increase is expected to hit 20%. State officials point to their tough negotiating and a strong, relatively healthy pool of enrollees for this comparative advantage. One caveat though, nothing is final yet. The ultimate rates will be locked in later this year and are set to take effect January 1st, 2026. So, the roller coaster isn't over. And this is the moment we want your input. Do you think state and federal governments should continue to subsidize health premiums? Should more be done to limit runaway medical costs, or is this just the reality of an aging society? What's the real root of these price surges? Hit the comments with your thoughts, especially if you disagree. Challenge the numbers or share your own experience. This is one debate that affects us all.